Bon, donc, bon matin à tous. Good morning, everyone. Welcome to the 4th Annual Science and Policy Exchange. Bienvenue à la 4e édition du Dialogue Sciences et Politiques. We have a great lineup of speakers for you today, basically which will hopefully inform and also entertain us to some extent about a variety of topics ranging from personalized medicine, drug policy reform, healthcare innovation, and cybersecurity, among many others. So before we start our close to 12-hour journey today, if you're able to stick around for an entire day, don't worry, there's a lot of breaks, a lot of chances to meet your fellow conference growers, so don't be shy, make sure to talk to everyone. I'm sure you'll have some great talks. So before we get started, I'd like to thank our sponsors, without whose support we obviously wouldn't be able to hold today's conference. So a great thanks to our silver sponsors, so basically Canadian Heritage, Patrimoine Canadien, as well as the Santé et Services Sociaux Québec, and McGill Public Affairs as well. And then all our other bronze sponsors, again, that have contributed and helped us to basically have today's conference. Throughout the day, when we'll be on break, you'll notice that there'll be a rolling slideshow here. There's two actually competitions that are advertised. So make sure when you have, I'm not going to go into details right now, but make sure to actually read them when we're in between panels and we're on our break. You might find it quite interesting. One of them is the St. Gallen Symposium. It takes place on May 6th to May 8th of next year. It's an international essay competition addressed to graduate students in any field as long as you're born in 1984 or after. So again, make sure to read the prompt when it comes up. And the second one is basically for the Canadian Science and Policy Conference. They have, this year is the first time they actually have a competition for basically also graduate students to come up with new policies that the Canadian government can actually implement. So make sure to read those when they come about. If you have any questions about the competitions, feel free to basically look me up during the different breaks and ask me a few questions. I'd be glad to go into more details about those. And yeah, so basically, without further ado, I'm going to introduce Carlos Patino Descovic, which will introduce you to our first keynote speaker. Have a great conference. Je vous souhaite une très bonne conférence et une bonne journée. Merci.
Hello, everyone. So it's my great pleasure to introduce Dr. Catalina López Correa. She, we think, is going to be a great speaker to introduce the whole day, because she really is in a bridge between society, academic, and industry. So she works for Génome Québec, which is a governmental organization that manages pretty much the different investments that we do in science to understand genomic applications and genomic discoveries. So in a way, she should be the best friend of all researchers. But to tell you a little bit more about her, so she did medicine in Colombia, and then went out to do a master's in human genetics at Institut Pasteur in France at Université Paris 7. That then she followed up with a doctorate in biomedical sciences at Université Catholique de Leuven in Belgium. Since then, she has mostly worked in genetics, on the scientific part, and less in medicine per se. But she has really worked, and this is why I'm saying that she's a good bridge, because she has worked at Eli Lilly in the United States, studying large genomic analysis to understand rare diseases. So she worked at Eli Lilly to discover, to set a drug discovery pipeline for drugs. And when she was there, she introduced pharmacogenetic analysis for some of these drugs. Afterwards, she went to Iceland, where she worked for Decode Genetics, and I think she had she was very lucky to work there, because they have one of the biggest databases of genomics for the whole population. It's something crazy like 30% or 40% that they have genetic information about the whole population. And then from there, she went on to Great Britain to work at Genomica, and she's now the scientific vice president affairs at Génome Québec. So today she will be speaking about what are we going to do with all this genomic data that is coming from the labs, from the government. We know that it's going to be very useful, but the framework legally and the framework ethically for using all this data is still under development. So as you know, science is always a little bit forward than policy. And today she will be speaking about how we should handle it. So let me please welcome Catalina López Correa.
Have spaces like this where we can try to merge and to exchange between science and policy. So it's a great pleasure to start the day today talking about genomics, which is my field as Carlos explained, and show you how the genomic revolution is really not only changing science, but changing healthcare and changing society as a whole. And how important will be to be able to match those changes and to frame those changes with policy and with regulation and with a particular and strong ethical framework. So let's start. I'm sure many of you know that we are really in the middle of what we call the genomic revolution. And we can compare this genomic revolution with the same thing that happened with computers. So we had computers, we had in the white lane what was the decrease in price and increase in memory power for computers that happened after the 60s, 70s, 80s. So now we all know that computers are an essential part of our lives, that each of us have 3, 4 computers at home, and everything is really managed by computers. Well, we can compare, same way, the decrease in green, you can see the decrease in price, the decrease in cost for whole genome sequencing. So it's even going faster than the computer revolution. It's really touching everything. So genomics now is not just in the lab, but it's really getting everywhere. And it's because, essential part is because of this amazing decrease in cost for whole genome sequencing. So on the other side, we have this technology, these advancements in genomics, but we have also a huge problem in the pharmaceutical sector, and it's the problem of efficacy. Many drugs are now being produced that have only between 30, 40, 50, and when it's really high, it's maybe 80% of efficacy. So if we have a drug that is given to a group of patients, it has only 20% of efficacy, will mean that in 100 patients, only 20, of course, will have the benefits from the drug, and 80 will have eventually the secondary effects and no benefits from the drug. So we really have to find a way to understand which medication will benefit which patient. And genetics is really one of the ways to help us understand that. So now with this merge of medicine, genomics, genetics, we're talking about a new paradigm. The new paradigm here, we call it P4 medicine, and is not my name or Génome Québec's name, is an acronym developed by Leroy Hood in the US at the Institute of Systems Biology. And basically, P4 medicine, I'll take this, maybe. Yeah. P4 medicine talks about medicine that is predictive, that is preventive, that is participative, and personalized. And some people now are also talking about a P5 medicine, where you add precision. Because this medicine, many people will say, many doctors will say, medicine has been always personalized. But the component that genomics and genetics is adding, and molecular biology in general is adding, is the precision component, is to be able to do the right diagnosis for the right patient and give, using that information, the right drug to the right patient at the right time and at the right dose. So how can we get this genomic information? How we, as a community, as a society, can get access to the genetic and genomic information? So there are basically three ways. The classical ways is through the healthcare system. So there are many tests that are now available in the healthcare system, either for diagnosis or for helping the doctors find the right drug for the right patient or the right dose. There is what we call in between. So there are some commercial tests that are not exactly made at the healthcare system, but are regulated, are calibrated, and are offered somehow by the healthcare system. So they are somehow outsourced to external companies, but they're provided somehow by the healthcare system. And the third way is what we call the direct-to-consumer genetic testing. So the healthcare system is not involved, the physician is not involved, and it's just the patient and society that can go directly through the internet or directly to the place and get a genetic test. So many of you have heard of some of these companies, 23andMe and so on. Has any of you tried any of these companies, any test, any genetic test online? Anybody has heard about these companies? Nobody has tested yet? Well, I tried. I'll tell you a little bit the story later. So what information you can have with that is your ancestry information, paternity information. You can have disease risk. And here we're not talking about diagnosis. It's not making a diagnosis, but is the concept of susceptibility and risk to develop a disease. And most of it is for complex diseases. So many of you heard the story of Angelina Jolie a couple of months ago. She did the test for the BRCA1, BRCA2. Those are two breast cancer genes. Genes that are associated with familial breast cancer. And she got positive results, indicating that she has more than 80% of chance or possible or risk to develop breast cancer. So what she decided to do is to do a double mastectomy. So this is a huge, huge decision, and really shows that patients or individuals, because she wasn't even a patient, she's healthy woman, she takes the test, and she decides to act on it. So a very important step for society. Of course, the medical doctor was involved there, but at the end of the day, it was her decision, her drive that took her to really somehow empower the patient and took her to make an important decision. On my case, well, I did, as Angelina Jolie did, my test, but not just for breast cancer, but all the 23andMe. And what it came with, well, a lot of information that's mostly, I think, important for an educational perspective, because you learn a lot from your family, your inheritance, your different risks. Particular risk that was interesting to me was that I had in my family, there were some people that two aunts that are having macular degeneration. And indeed, when I did the test, I had also the gene for, or the mutation or variant for macular degeneration. So for me, it's important to act on it, same as Angelina Jolie did, to take vitamins, go to checkups every year for my eyes, and be aware that this might come. Of course, I have no problems now, but this might come when I'm 60, 70, and that I could eventually act on it as soon as there are medications available. So these are the ones that we were talking, the test I did, and the ones we were talking were tests that are not fully regulated. Those are offered by private companies. You can buy them online, or you can, some of them can be purchased directly to the company. But there are other tests that are now being regulated by agencies like the FDA or EMEA in Europe. So the FDA started with 3 types of tests. In red, you see the tests that are required. So we don't need to read the list or anything, just to give you the concept. Some of them are required. So when a medical doctor prescribes a drug, you have to have the test in order to take the drug. There are some others in yellow that are recommended. So in the label of the drug, they say this test is recommended. If you're taking this drug, it's better to take the test to make sure that you are the patient that will benefit from that drug. And some others are still at the stage of information only. So they're not really mandatory in terms of prescription. So with all this happening now, with all the advancements in genomics and all the advancements in how we can get access to that, we can easily envision what the New Yorker published as almost science fiction a couple of years ago, with this cartoon saying that you could eventually go to a pharmacy using your sequence and get your prescription exactly according to your genome and to exactly your genomic information. So we are not actually today that far from that cartoon. Now the issues, of course, and what we are here to discuss is not how great is science and how much is changing the healthcare, but how can we work as a society and as a group that works on policy and ethics to develop the right framework to take this for the better, the benefit of society. So there are a few issues. The first one is that technology is advancing very, very, very fast. But society and the healthcare system really are maybe not evolving exactly at the same speed and in the same direction. So to have the benefit of this technology, we really need to have this dialogue and ensure that they're both growing in the same direction. Privacy, as you might imagine, is also a big issue here and an important point to take into account. Regulation, as we saw, some of these companies are not regulated by the FDA. They offer those tests, and they don't have any particular regulation. We are not sure which of those companies is better. Is the quality of the test of one better than the other one? Nothing of this is known because nothing of this has been regulated. Another important point is Angelina Jolie, and that's the example of Angelina Jolie, is patient empowerment. So we are seeing that doctors, they, of course, play a key role in the healthcare system, but they are not, as they were in the 50s, in the 60s, the person that will know everything about the patient. Now there's so much information, so many different sources, that is finally the patient, really, who is the one that's able to put all the dots together and take really care of his health with the help of physicians and specialists and all the healthcare system, but it's really the patient that has to take a lot of this responsibility. Now, big data, we're going to talk a little bit more in detail, but that's a big issue also, because all these genomics, you saw the first graph, with the decreasing cost in genomics, we are generating huge amounts of data. We say that just in 2013, we generated more data than has been ever in the history of humanity being generated. So how can we handle that for the, for the benefit of the patient, for the benefit of society, for the benefit of the community? NIP, commercial intellectual property and commercialization rights for the different tests. Is this just to, tests are just to make money? Are these companies just worried about making money, or for the good of the patient? Now, talking about big data, there is an important initiative that is being developed now, and that is a lot focusing on how to share this data. There are 70 countries that, 40 countries, sorry, that are involved in this global alliance. It's for clinical genomic data. And here in Montreal, actually at McGill University in Montreal, there is a group, the group from Dr. Bartek Knoppers, that is setting up the IPAC, which is the International Policy Interoperability in Data Access Clearinghouse, which exactly is working on policy and just define the framework, informed consent, ethical issues for the global alliance, and really define the framework on how this data will be shared, respecting all the ethical components in there. So it's a key part of this, and we, Montreal, McGill, are essential part of this initiative. Now, there are some regulations already in place, and some countries like the US have developed policies specifically to protect patients and to define a framework. In particular, there is one that is called the Genome, the Genetic Information Non-Discrimination Act, that was put in place and approved, I think 5-6 years ago in the US. There is another, the HIPAA, Health Insurance Portability and Accountability Act, and that's maybe mostly for individuals between 12 and 18 years old. So it's protecting them when genetic information is taken. Now we know that with the increased amount of technology and genetic information, there is a lot of debate about newborn genetic screening, young children being sequenced for the whole genome, where you can get the information for the disease you're looking for, but you can get also the information from many other things you might not be looking for. So that also needs to have some regulation in place. There is also lots of regulation in the US, Europe, and some in Canada regarding lab practices. So GLP, CLIA, ISO, but there again, CLIA is the label of quality and regulation in the US. Here in Canada, we have another label. So it will be really important now that we somehow develop this quality practice that are more international, a little bit like the Global Alliance, try to work on developing international policies where we can ensure that whatever in the world you sequence your genome, you will have exactly the same quality of data and exactly the same type of information. The FDA and EMEA for all the drugs and treatments and devices are working very, very hard in developing these policies, also guidelines, and developing also the framework to help the insertion of these developments in society. Now, regulation, as I say, is a very, very important component. In Canada, in particular, we need to work on defining this framework, defining who is paying. We here, as compared to the US, we have a universal healthcare system. So who's going to pay for these advancements whenever we have, like I show, the drugs or medications that require to have a test. So the healthcare system not only will have to pay the drug, but will have to pay the test. And of course, the test at the end of the day is for the benefit of society and the patient and will reduce cost at the end of the line. But at the beginning, of course, it's an increased cost because you have to pay not only the drug, but pay also the test. So we need to work with different frameworks, and in that particular point, integration of into the public healthcare system, Genome Quebec is organizing next week on Tuesday a forum in Quebec City where we have 4 keynote speakers invited and 12 PIs, principal investigators from Quebec that will be talking about personalized medicine, genomics and personalized medicine, and how we can integrate these technologies into the healthcare system. So that's an ongoing debate, a very important discussion that we have to have with the different players, and we're trying to do as you're doing today. We're trying to put together scientists, politicians, regulatory agencies, so really to promote this exchange and this dialogue to prepare the society to embrace all these technologies and innovations. Clinical utility also very important. So many tests are being developed. Many tests are, from an innovation and technology point of view, very interesting, very scientifically accurate, but maybe not fully clinically, they don't show clinical utility. So that's, again, a very important point. And finally, evaluation of the socioeconomic benefits. As I was saying, maybe the regulatory agencies, their first instinct will be to say, well, for me now, having to approve a drug and having to approve a test, that's double work and double cost. But when you think that if you give a drug and it's only effective in 20% of the patients, and you can define which are those 20% of women with breast cancer or men with prostate cancer, you know exactly who they are, and you're not treating the ones that will not benefit with the drug. So at the end of the day, something that apparently was more expensive will be very cost effective and actually will save money to the system. But this still We still need to have a lot of examples to be able to really show to the healthcare system that this is the case and this is the way we're all going. An important point for Canada is that we saw GINA, and there are actually all the G8 countries have regulation regarding genetic data. I say all except actually one, which is Canada. It's the only country that don't have any framework for regulation for this genetic data. So I think it's for you, you're the key people to help us work on this and ensure that we develop the right framework to develop these policies. Now we need to extend those policies also to go beyond health insurance and employers and cover housing, education. So there are many, many aspects to these. And find the right balance between keeping data private, but also giving access so that the patients can benefit, society can benefit, Now, at the level of the individual patient, so it's important individual and family consent. So all this, as I say, is a lot of work is being done at McGill by Professor Barta Knoppers. Managing the information, great issue, very important issue. Respecting private life and right to information, and getting access to genetic counseling. Because having all this information and not knowing exactly what to do doesn't really help anybody. So at the level of the healthcare system, I guess these are the four most important points. First, if we want to have access of data, big data like genomic data, we need to have an infrastructure, basically electronic health records, where medical doctors can get access to that, can get access to all the file of the patient from different levels, different specialists. So that's an important framework to develop. Another important framework is the education of medical doctors. Most of the medical doctors now, they are not very familiar with genetics, not very familiar with genomics. The classical genetics, yes, but all the data with genomics, all this information coming from the 23 and all these companies, medical doctors are not familiar with that, with pharmacogenomics and all these concepts. So we need to work hard in the education of the healthcare system in general. Standardization, as I say, regulation, making sure that all tests provide the same information. And patient empowerment. At the end of the day, all of us here one day will be patients, and all of us somehow will need to understand genomics, not really genomics as a science, but what this genetic or how important is this genetic information to guide our treatment and help us do a better diagnosis. So a couple of days ago, just to finish, here in Montreal, Steve Burrell from California came. He's working a big venture capital company. And he came and presented this slide and talk about BlackBerry and Walmart medicine. So he say, basically, in 15, 30 years, we will be having this model. You will be able to follow all your measures in your body, like blood pressure, sugar, heartbeat, everything with your BlackBerry. You will get your EEG, all your information in your BlackBerry, and you can just go to Walmart and get a drug. So medical doctors will almost not be necessary. Well, of course, that is an extreme example, but we are not so far from that today. As you know, there are many applications that are being developed in healthcare that you can download in your mobile device, that you can follow your health. Diabetic patients now, they're following their glycemia, everything with their mobile applications. They can go and regulate their insulin according to their data, of course, with the doctor. We're not here removing the doctor as did Steve Burrell, but it's important, it's patient empowerment, and it's important that all of us are part of it. And just this last slide, just to wrap up with basically the patient at the center, and the patient, as I say, is all of us, and all these technologies that are being developed basically around DNA, around genomics, and the need for us as a community to develop, as I say, the right framework to make sure that all this is regulated in the right way and that all ethical aspects are covered. So with that, I think, thank you very much.
Thank you, Catalina, for a great talk. So now we will welcome the audience for a few questions. We have a couple of minutes. If you wish to ask a question about what we just discussed. Well, I will start. I have a question. So we talked a lot about genetic information and how we will manage it, but in a way, who will be counseling the public about, you know, what a gene is, what a risk, a genetic risk is, because you know, they can be misinformed on the internet by all these websites that are not correctly put up to date all the time, and at the same time, you know, private companies can also maybe take advantage of fear of you know, this genetic risk. So, will we be teaching more information to medical students, or will we have more genetic counseling in hospitals? How do you think this will work?
Yeah, really good question. So we, and I say we because Génome Québec is involved and many other organizations are trying to set up different frameworks at different levels. So one important one is at the level of medical school. I think it's really important that medical doctors, the young generation of medical doctors, are well versed and educated in genetic risk and how to use genetic to prescribe the right drug to the right patient at the right time and so on. There are some companies that are doing a really good job in education. 23andMe has the whole tool explaining what is a risk, how you can interpret the result and all that. But as you say, the risk there or the problem there is the variability that you can get between the different companies. Not all have the same level and the same quality of information. So there is an important role that we have to do. We are also working with high schools and science teachers in different schools, and I know there are many organizations in the US, also in Europe, that are trying to work at the school level. So trying to work with medical doctors, the schools, and genetic counselors also are a very important component. So it's really the whole society. We basically need to educate.
Any questions? Yes.
You mentioned that there is a gap between reality and the implementation of policies regarding privacy and standardization of genomic tests. So I wonder, like, for your personal experiences, when you did your test, what was your concerns regarding having your personal genomic data available to a for-profit company? And also, what was your criteria of choosing one company for this test rather than the others?
Okay, yeah, good question. So I have to say that I really didn't start thinking if this will be available and what the company will do with that. I used to work, as Carlos said, for Decode Genetics, and we handle genetic data for 150,000 individuals from the total of 300,000 in Iceland. So half of the Icelandic population, we were managing their genetic data, and it was encrypted, and it was never abused, let's say. So it was always kept in a, so I always go from that principle. I always go think that 23andMe, the company I choose, will do this, keep it encrypted, and when they want me to participate in something, they ask me through an email, and I say, yeah, I want to participate in this study, so you can use my genome to participate in this, and so on, and so on, and so on. But it's always based on consent and based on my will or not to participate in a test. Now, how I choose 23andMe, because at the time when I did the test was the most solid one. But again, there is also a risk, and it's not 100% sure that the quality is, let's say, waterproof or perfect. There was an article, indeed, a couple of, maybe 1 or 2 years ago, where a journalist did the test with 3 companies, 23andMe, DecodeMe, and Navigenics. And at that time, he didn't get, not for all diseases, but he took maybe a couple of diseases where he didn't get exactly the same results. So yeah, there is a risk, and that's why we really need to develop a regulation for those companies. I think they add great value, and I think they're doing a great job in what I call bottom-up education, because patients now can access some, in the US now, a very common Christmas gift is a 23andMe test. So you give a friend, and the friend now will get this or a family member, and they get all this information, genetic information. Well, they will end up learning about it just because they read, they try to understand what is this variant, they go and see the doctor with the test, try to challenge the doctor with that. So it's really a bottom-up approach. It's not perfect, but it's really helping advancing the science and the policies too.
So yes, one last question.
It was an excellent talk. Thank you very much. I'm really interested in the legal aspect of kind of where this is headed. So in your ideal world, will the government be able to legally get hold of this information if there is a trial of some sort, you know? So I'm trying to understand, you know, how will it be regulated? Will it always be just your information and it won't be used against you? Because I can just imagine, I'm making a pretty dramatic situation here, but I can imagine if you're making an insanity plea and you can prove that you have some gene that has a 20% chance of you being insane, that just strengthens your legal defense, you know? How do you see this playing out?
Yeah. Well, it's a little bit what the Global Alliance is also working, you know, because they're working 40 countries, they're centralizing all the data, they're putting the data in the cloud, and they're trying to give access to many different people. So data in that case is anonymized because it's a research purpose, but you know, it has to somehow become also like your family history. There's, at many levels, you can have access to the family history and know that so-and-so in your family was, had schizophrenia or had bipolar, and so is that family history taking to the next level. But of course, I think we really need to develop the framework, as I say, with my example of 23andMe, and it's really the patient that should be empowered to decide with whom he should share that. But it's important also for society and for scientists, here is my scientific hat that speaks, that this data somehow is shared, anonymized, it's perfectly fine, but that the data is shared because the large amount of data is the only way where we can really draw conclusions on what are the genes associated with certain diseases. So it's important, the concept of data sharing too, in that case. Well, thank you all, and I wish you a very, very productive day. Thank you.
Let's thank Catalina for a great talk, and we wish to give you this as a token of appreciation. Thank you very much. Thank you.